Hello, this is Karen Harrison. Welcome to Reiki Call Podcast. I'm excited that you're here. My website is karenharrison.net, and my guest tonight is Dr. Ann Baldwin. She is a recently retired professor of physiology from the University of Arizona, and she's director of Mind Body Science in Tucson. She's a Reiki master and has practiced on Reiki in people and animals for the last 20 years. She's published over 120 articles in peer-reviewed scientific journals and a book called Reiki in Clinical Practice, a science-based guide, which you definitely need to get it. You can get it. Yes, thank you. Hold that up, and you can get it through Handspring Publishing.
And Amazon.
And Amazon. Okay, that's good. Makes it more convenient. In her spare time, she loves to ride her horse and is a horse handler for Therapeutic Riding of Tucson. Her website is mind-body-science.com. And if one of our viewers asked about where you can get this podcast, and it will be on my YouTube channel at Karen Harrison Reiki, and also on my website at karenharrison.net, and on iTunes and Google Play and other places where you get your podcast. So anyway, welcome, Ann.
Thank you.
Yeah, thanks for joining us. I've been enjoying getting to hear Dr. Baldwin speak at our Reiki retreat every year for a number of years so that I can keep up to date with Reiki and science, because I think that's important, as Reiki is becoming more popular in the mainstream, to be able to cite research that shows that Reiki is a valid modality that helps in many ways. So I've got a few questions for Dr. Baldwin. So, Reiki is becoming more popular, and it's been added to the list of services of hospitals in UK and US, but how widely accepted is it by the medical field?
It's getting better. I think it's probably more widely accepted in the UK than it is in the USA. But the only problem is there's still a long way to go. There are still people who've never heard of Reiki in the medical field, so there needs to be much more education. And really, from my experience, the only way to get people convinced that Reiki is going to be of any benefit is if they can just try it. If we could somehow work that into the system where we could offer to give short Reiki sessions so that they could feel it, then I think that would really help a lot. Because, we're getting more and more data, that's true, about Reiki and how it affects you with your physiology and with your emotions, and how good it is to reduce pain, etc. But the thing is, even though we have this data, some scientists and people in medicine who make decisions are just shutting the door on it. And that is a big negative because, for example, the National Institute of Health that fund the major part of medical research in the USA, if you go on their website and you type in Reiki, it will tell you that there is no evidence that Reiki has any benefit in medicine at all, which is totally inaccurate. And we've been trying to get them to change that, but they are not listening.
It's been that way for several years. I remember you mentioning that.
Yeah. And then the NHS, National Health Service in the UK, very recently, they said that they saw an advert for a Reiki practitioner for their National Health Service, and They just said this is total pseudoscience, and they shouldn't waste money like this. They shouldn't waste taxpayers' money. So there's a long way to go, but it is getting better.
Yeah, that's frustrating.
Mm.
You know, when there is quite a bit of research. So, speaking of that, you've been participating in the Touchstone project. Can you tell us what that is and what the goals, findings, and conclusions are?
Yeah, so this is an ongoing project that was started by William Rand, who is head of the International Center of Reiki Training and also the Center for Reiki Research. And about, I must think maybe 12 to 15 years ago, I suddenly got this call from him. And he said that he was putting together this board to find out the evidence, the scientific evidence behind Reiki, because he came to the conclusion, just like I've just been describing, that in order to get Reiki accepted in medical settings, we need to provide people with hard data. And so his aim was to put together this project, which he called the Touchstone process, where he would get a group of scientists and medical people together, and we would meet monthly, and we actually developed a way of evaluating peer-reviewed research on Reiki and summarizing those evaluations. And we have a website, which is centerforreikiresearch.org, Center for Reiki Research, all one word, .org. And you can go on there and you can find the summaries of every single peer-reviewed research article on Reiki that has been published. And so during our evaluations, we score the studies, and then we summarize them and put them on the website. So we have, in the summaries, we also include strengths and weaknesses so that people can see if a certain study is a robust study or not, and exactly what it shows about Reiki.
Yes, I remember those were published in a book for a while, but I guess now they're all available on the website, so you don't really need the book.
Yes.
I went through and I read them all.
So this is ongoing, and we have monthly meetings, and we've just had our monthly meeting a few days ago, and we had 3 more papers come up, which we've assigned for evaluation and summary. So we have at least 2 people to evaluate each paper. And if they don't agree, then we get the 3rd one.
Wonderful. And so you determine which ones meet the gold standard of research and which ones don't.
Yeah, so we're looking at things like how many people are in the study. Do they have a control group? Meaning that if, for example, they're testing to see if maybe does Reiki reduce anxiety when people go to the dentist? I'm just making that up, but that's an example. And if you're doing an experiment like that, then you would have, you would give people a questionnaire, or you would make measurements on them before they had the Reiki session. Then you'd give them the Reiki session, they go to the dentist, and then you would do the measurements again afterwards. But you would also need a control group that didn't receive the Reiki, so that you can compare that it's the Reiki that is having an effect and not just passage of time or something like that.
Well, that would be a really great experiment. I used Reiki at my last dental appointment, where she did 2 fillings and a crown preparation all in one. Quite extensive. And she said, wow, this went perfect. I said, well, I sent Reiki in advance, and I was Reiki the whole time.
Yeah, and in addition, some people would say, well, maybe it's not the Reiki that is giving you the benefit. Maybe it's just someone, being there and supporting you and giving you attention. So that's why we have something called sham Reiki in good experiments, where you have someone who is not trained in Reiki, and they sit with you and they look as if they're doing Reiki. They're doing the hand positions, but they're not doing Reiki. And ideally, the person is not told whether they're receiving Reiki or the sham Reiki until after it's all over.
Great. And so then that will give the very best results.
Yes,
That
and
would be the
yeah,
goals.
it's important that we have enough people in the groups as well. Um, when you're starting out, you often do pilot studies where you have perhaps 10 people in each group. But to get something accepted and to get it more meaningful when it's being analyzed with statistics, you need a greater number of people. So at least I would say 50 people per group would be good.
Mm-hmm.
So we're looking for numbers in the group. We're looking for, do they have a control? We're also looking for how well do they describe the procedure? How well do they describe, like who did the Reiki? What training did they have? How many years experience did they have? What exactly did they do? That's all very important. And very often we're finding that people seem to leave out those details.
Oh, wow. Yes, I can see that. Well, I'm now envisioning this study with a bunch of holistic dentists across the country. I think that'd be very cool.
Well, actually, I had this is years ago, but I had to have 2 wisdom teeth taken out, 2 impacted wisdom teeth. And I did Reiki before and during and after. And I was given prescription for pain medicine, and I didn't even get the prescription. I didn't need it.
Well, that's pretty amazing. And didn't you tell me you had some other procedure done where you didn't have any anesthesia?
Oh, yes, I had a routine colonoscopy done without anesthesia. And that was fine.
Well, that's really amazing. Wow.
But anyway, you ask about the findings. So
Yeah.
we have about I think maybe close to 110, 120 papers that we have put through this process now. And when we look at the analysis, it seems that they are showing evidence that Reiki is helpful for reducing anxiety, for reducing chronic pain and acute pain, particularly good for pain during surgery. Very good for as an adjunct for people having chemotherapy for cancer, because chemotherapy has a lot of side effects, and the Reiki seems to reduce those side effects, reduce the fatigue and the pain and the anxiety. So that's quite clear. The results are quite clear about that.
And then also length of hospital stay after surgery.
Right. And hospitals, their bottom line is how much does each patient cost? And so if the Reiki is going to get the people out of hospital faster, you would think that they would want to invest in Reiki.
Yes, that would make sense. Well, and also, yeah, for patients undergoing cancer and chemotherapy treatments to, not feel as nauseous and sick and have a better quality of life. And then also, I remember it increases the connection between the caregiver or whoever is giving the Reiki and the person receiving the Reiki. So if the caregiver were trained in Reiki, then that helps them to have a better relationship.
That's true. And then also Reiki helps the caregivers as well. There are quite a few studies showing that, especially with nurses. When nurses are trained to do Reiki on themselves, then there are quite a few studies showing that it reduces burnout.
Yes. And Lucy is asking if all the studies are qualitative.
No. Most of them are quantitative.
And you want to explain what the difference is between a qualitative and a quantitative study?
Yes. So a quantitative study is something where you actually make measurements. So, for example, making measurements of blood pressure or heart rate before and after Reiki, or maybe taking a saliva sample and measuring cortisol levels, stress hormone levels. That would be quantitative. There is also a weaker quantitative type of study where you give people questionnaires that are very established, tested questionnaires. There are questionnaires for well-being and for anxiety, for depression, that have been used over and over. And scientists agree that they are actually a good measure of those markers like anxiety and depression. So you get scores of anxiety and depression, various questions that people answer before and after. But a qualitative study would be if, for example, you interviewed people and then asked their opinions about how they felt during the Reiki or after the Reiki or before the Reiki. Then in that case, you would get, like, we call it qualitative because it's not an actual measure. You're maybe comparing the kinds of words that they use or the phrases that they use. That's also very important because not everything can be measured. And I think scientists are very much biased towards things you can measure, otherwise it's not real. And I think we need to open it up a little bit and also include these qualitative studies, because I think they have a role to play also.
Yes, absolutely. Well, and I am a trained therapist, so I'm very interested in people's opinions about their levels of discomfort, with their emotions. And that's one of the things that I brought into my Reiki practice. I like to find out, what the concerns are, and then rate the intensity of their emotions, say sadness or anger or guilt, on a scale of 0 to 10 at the beginning of the session and then at the end of the session.
That's very good. That brings me on to a study that I was involved in. Natalie Dyer was the lead author. And in this study, we were wanting to do like a real life experiment rather than one set up in a lab or something or an office. We wanted a real life experiment. And so we gave surveys to people who were going to their Reiki practitioners, just like, regular session, usually in their homes. And all the Reiki practitioners, we did say that they had to be trained by the International Center for Reiki Training, so that they would all have the same training, because otherwise it would be too difficult to analyze. But we got, I think, about 200 practitioners, and we analyzed 1,400 Reiki sessions. So the people went to their provider, and then they were given questionnaires, established questionnaires to fill in before their session and after their session, so that we could make comparisons of things that, the kinds of things that you're describing, like pain, anxiety, fatigue, that kind of thing. I think I may have a list here. Yeah, we had pain, tiredness, drowsiness, nausea, appetite, breathing, shortness of breath, depression, and anxiety. And we had 1,400 sessions, so a big number. And we had statistical significance showing an improvement in all of those qualities.
Wow. Now, is that published somewhere?
Yes, it's published.
Okay. All right. And
so her name is Natalie Dyer, Dyer. And if you Google Natalie Dyer Reiki, you'll find the paper.
Okay. Well, that's fascinating. All right. Well,
I have it here. It's called A Large-Scale Effectiveness Trial of Reiki for Physical and Psychological Health.
Wow. Okay. Thank you. So Lucy is now asking if HIV clients who have received Reiki, have they had an increase in their T cells?
I don't know. I'm sorry, but we don't, no one's measured that and published it, so I can't answer that question. But that would be a super experiment to do.
Maybe Lucy's to do.
Okay, so anyone who has friends or knows people who could do that, yeah, that would be wonderful.
So what are some of the major weaknesses of Reiki research studies and their strengths?
Well, I mentioned already, a lot of them have only small numbers of people in them. And I mean, that is okay just to see if there's something worth studying. But for real statistical data, you need a larger number of people in each group. And so, for example, the NIH, I mentioned the National Institutes of Health, one of their objections is, okay, those Reiki studies are just too small. Well, yes, a lot of them are too small, but there are some large ones as well, which they conveniently ignore.
No.
So that's one thing.
Large?
I mean, that's a valid criticism.
Okay. What's considered large?
I would say a large would be 100 people per group.
Okay. So you would need the control group, the Reiki group, and the sham Reiki group.
Yes, so you need 300 people. Yeah. And that's going to cost a lot of money to do, because these studies, you have to pay, the people who are analyzing the data, you have to pay the practitioners and organizers. So it's not cheap. And that's, and if the NIH is saying, on the one hand, they're saying, oh, well, Reiki has not shown to be of any benefit medically. And on the other hand, they're saying, well, the studies aren't big enough. And they're not funding the studies because they don't believe in it. Then how are the studies ever going to be done that are big enough?
Well,
so right now I think we're at the mercy of private foundations and maybe doing things like crowdfunding.
Has there been any crowdfunding for Reiki?
Not as far as I know, but that would be another option.
Well, that would be an interesting thing for the Center for Reiki Research to put out some feelers on, I think that'd be fascinating.
Yeah.
I'm thinking that the dental office, that ought to be not so hard to do.
Yeah, that's right.
Office. I would think a lot of people would say, yes, sign me up.
Yeah.
Your place of anxiety.
And then going back to the weaknesses, another weakness is still lack of control groups. There are still publications coming out where they don't have adequate control groups. Either they don't have a control at all, or else maybe they have a no treatment control, but they don't have a sham Reiki control.
Yes. Now, before people start research, is there someone from the Center for Reiki Research that can consult with them and advise them about their study?
We theoretically we do have that, but it turns out that is quite a big job, and we're all kind of busy people. Yeah. But if you go on the Center for Reiki Research website, there are some very good papers that are posted up there that tell you what is needed for a good Reiki research design.
Okay, well, then that ought to handle that.
Also, we have webinars once a month, and I gave one not long ago about how you design Reiki studies, and they're posted up there too.
Oh, okay. Well, that's
that way you can just take your time and look through them, and then maybe after you've done that, and then if you have any questions, then we could help you.
Okay, well, that makes sense. So you have all the resources there. People just need to avail themselves of that. Okay, wonderful. So let's see, do we talk about the medical benefits that have been reported from Reiki?
Yeah, so basically it's what I already mentioned about the acute and chronic pain, anxiety, well-being, burnout. Those are the ones where Reiki has definitely shown a statistically significant improvement.
Okay.
And there are other things like immune response, fibromyalgia. Yeah, but there have been a few papers, but not enough to come to a conclusion yet.
Okay, well, yes, with fibromyalgia, that would be that would be very nice that people suffer.
Yeah, right now there are 2 papers on fibromyalgia. One was positive and one was negative, so we can't really come to a conclusion from that.
Okay, and an example of a well-designed study that's robust, high quality, and with significant results, is that the one you talked about with 1,400 people participating.
That was good in that it was a real life study and that it had a large number of people. The only criticism, of course, is there was no control group, because you can't have, ethically, we couldn't have people going to their Reiki provider and getting fake Reiki or or not really getting Reiki. So we didn't have a control group in that. So that is open to criticism. There was another study with a large number of people that, well, there are several, but there's this one here I'm going to read here. This was done in 2020, and 180 cancer patients were given Reiki. So 180 were divided into 3 groups of 60. One group got Reiki, one group got guided imagery, and one group got no treatment.
Mm-hmm.
And what they found was that they gave them a questionnaire before and after to assess pain and fatigue. Mm-hmm. So these are established questionnaires. What they found was after the Reiki, the ones that got Reiki, they had significantly less pain and fatigue after Reiki than the ones who did not have any treatment. But the guided imagery also showed that as well. So basically, Reiki and guided imagery were both beneficial. But that was a good one because it had like different groups. It had a large number of people in each group. 60 is pretty good. Between 50 and 100 is pretty good. So there's one that had positive results, and it's pretty robust.
Mm-hmm. Okay.
There was another one that I was involved in. This was a pilot study, so it has a disadvantage of there are only 15 people per group. This was knee replacement surgery. Mm-hmm. And we had one group who had Reiki before their surgery and afterwards, one group who had sham Reiki, and one group did not get anything, neither Reiki nor sham Reiki. And in that study, there were significant reductions in pain, anxiety, the amount of medication they needed, and how quickly they got out of hospital. So and nothing with sham Reiki or no treatment. So it was only the Reiki that showed a statistical improvement.
Yes, that's an exciting study. I always cite that one in my Reiki classes.
Yeah. And there was also another knee replacement study showing similar results. Mm-hmm. So it wasn't just a one-off. Yeah.
Mm-hmm. Okay. And if anybody else has any questions, feel free to put them in the chat, or you can ask. But in the meantime, let's see. Oh, okay. Did they receive Reiki daily, and for how many days?
Oh, that's a good question. So they received Reiki the day before their surgery, and I think they were half-an-hour treatments. And then they received the next day after their surgery, and then the next day after that, and the next day after that, if they were still there. So they had 4 treatments total. But some of them missed the last one because they're already sent home.
Wow. And that's only 30-minute treatments.
Yes.
Well, that is really amazing. I imagine that is much cheaper than the hospital stay and all the pain medication and everything.
Right.
Wow.
Yeah, so the Reiki and the sham Reiki, that was a double blind because they didn't know what whether they were getting Reiki or sham Reiki, and the people analyzing the data didn't know what the groups were either. They were just called A, B, and C. Mm-hmm. So that was a strong study. Of course, the ones who got nothing, they knew that they got nothing, and and it was hard to get people to be in that group.
Oh, that's funny. Okay, well,
one way you can get people to be in the no treatment control group is to promise that after it's over, they'll get Reiki treatment.
Yes, if they're still in the hospital. All right. So while we're talking about Reiki and science, can you give us a scientific explanation for how Reiki works?
No, I can give
Darn, I thought that might be the answer.
I can give you ideas, but nothing has been proved. No one really knows what is this energy and how does it work. Some people say that they've measured the energy, but I'm still not convinced, because sometimes people come to me with devices and they say this measures Reiki, and then I find actually it's not measuring Reiki, it's measuring heat or something like that. Mm-hmm. So no, we don't know the characteristics of the Reiki energy. I did an experiment to see if it was electromagnetic. This was done in San Diego at the Scripps Institute, where they have a machine that measures very low intensity electromagnetic fields. And so we had Reiki practitioners in front of this machine doing self-Reiki, or also doing distance Reiki, sending Reiki to somebody outside. Mm-hmm. And we wanted to know if, when they did Reiki, did the measurement of their electromagnetic field. So this device can actually image and measure your electromagnetic field and all the frequencies that it's vibrating at, because we all have an electromagnetic field that is produced by the heart and a small one that's produced by the brain. We all have that natural electromagnetic field. And one theory is that maybe Reiki works with that field to alter its vibrations. Sometimes the vibrations get off, and it's been shown that each organ and each system has its own particular vibration that works for it. So like the skin has a vibration, and the lungs have a vibration that works for them. And the theory is that when you have issues, medical issues with the different organs, basically it's because their frequency has gone haywire. It's not at their most optimal frequency. And the theory is that the Reiki can act through that field to change the vibrations to put it back to what it should be. But in this study, when people did Reiki, we could see no changes in the frequency compared to when they weren't doing Reiki. We even had a group of people that were not trained in Reiki, and we measured their fields. And then we had William was over there too. He gave them a quick Reiki attunement, and then got them to do Reiki to themselves, and we didn't see a difference. So number one, maybe just in that short time, that wasn't enough. The attunement wasn't enough to cause a measurable effect in their field. Another idea that I had is that I find that when I do Reiki, I feel much more connected when I'm in nature, when I'm outside, and than I do if I'm in a building. Mm-hmm. And I think perhaps, so this machine that we used to measure the electromagnetic field, it was in what's called an electromagnetically shielded building. So no other radiation, electromagnetic radiation, could come in to interfere with what it was measuring. Mm-hmm. But one idea is that maybe Reiki is somewhere in the universe, and it comes from the universe and then kind of stimulates the Reiki in us, if you see what I mean. Mm-hmm. And the Reiki practitioners who were in this room, they were separated from what was going on outside. So if there was any kind of universal Reiki trying to stimulate their own Reiki, that wasn't happening. So that's another perhaps a reason for why we didn't see a difference. Or it could just be that Reiki is not electromagnetic at all, and it doesn't act through that field. So we still don't know how it works, basically. That's the short answer.
Okay. Can a magnetomyogram or an EKG measure Reiki?
So yes, EKG, that would be a good one. And in fact, there has, believe it or not, although there's been measurements of, no, hang on, EKG, yes, Reiki does affect the EKG. It affects heart rate variability. But that still doesn't tell us exactly how is the Reiki working and what is the Reiki energy. We still have not been able to say, okay, person, stand in front of this machine and let's measure your Reiki and see how intense it is and what frequency it is. We still have not been able to do that.
Mm-hmm. Okay. And
But
what about a magnetomyogram?
that's a possibility. I don't think that's been done, so that would be another possibility. Another thing that I don't think anyone has done a published study showing how Reiki affects EEG, the brain waves either, the electroencephalogram.
Oh, well, that shouldn't be too hard. That sounds interesting.
So there's still a lot to do, but we haven't got there yet.
Okay.
And you know that is a big disadvantage. Going back to skeptics and science, that's a huge disadvantage because scientists always want to know, well, how does it work? And you say, we don't know how it works. Oh, well, there's no mechanism. So how can we believe it? You don't know the mechanism. But on the other hand, aspirin, the mechanism for how aspirin works was not found for 70 years after people started taking aspirin because it got rid of their headaches.
Wow.
So you don't need to know the mechanism to take advantage of it.
Mm-hmm.
But even so, because of the way scientists are trained, they think that if you don't know the mechanism, then it can't be real.
Yeah. So, well, and Lucy was asking if Reiki is related to quantum physics.
That is still not known for sure. The thing is, when we try and explain distance Reiki, that's when normal physics doesn't work for us, because normal physics says that the further you get away from a source, the weaker it gets. So if you have someone giving somebody Reiki and they're like 6 inches away, it will be very strong according to this. But if you have them giving Reiki 6 feet away, it will get weaker. If you have them giving Reiki in the next room, it will be weaker. If you have them giving Reiki in the next building, it will be weaker. And that, according to distance Reiki, that doesn't work, because when you receive distance Reiki, it seems like the person is just with you, right? Mm-hmm. That's how people describe it. And the only way that can happen is if we have, in order to explain that, we have to go outside of traditional Newtonian physics and consider something like quantum physics, where things can happen even if it's kind of out of the space-time continuum. So space and distance and time don't matter anymore. That's really what quantum is. So we haven't got any evidence that quantum physics is involved, but we can't explain what we experience with traditional physics. So does that answer your question?
That was a good one. Lucy's got some great questions tonight. So, well, Ann, when you're in teaching Reiki classes, what do you tell your students about how it works?
Well, basically just what I've told you about the various hypotheses, the hypothesis that it could maybe be working through our heart field and changing the frequencies, the hypothesis that maybe it's somehow connected to something in nature and it has to, perhaps one theory is that the Reiki stimulates the pineal gland in the brain, and that sends messages to the rest of the body, and perhaps Reiki can enter us through that way. That's another possibility. But right now we don't have any evidence at all, but we can just consider these various options and perhaps think of special ways that we haven't tried yet to test these hypotheses.
Mm-hmm. Yes, absolutely. And Lucy was commenting about how she likes how Reiki brings us into a state of mindfulness.
Absolutely. Another thing that I teach my students is the importance of the breath. Mm-hmm. That's what the mindfulness, that's what reminded me of it, because you can, in order to be mindful, you have to slow down your breathing. Mm-hmm. And your breathing actually affects your field, your heart rate variability field. It waters the frequency of your field in your heart. And that change is transmitted through the nervous system to the brain. So it alters the way you're thinking, so that when you're breathing more deliberately and more slowly, you become mindful, because number one, your heart field changes to a different frequency, and this is sent to the brain and alters how different parts of the brain respond. So for example, it will affect the thalamus, that is responsible for one of the things it does is coordinating what's going on in different parts of the brain. And if you're breathing in that regular way, that deep, slow breathing, then your frequency in your heart field changes, and then that will affect the thalamus, so it can more easily coordinate what's going on in your brain, so you can think more clearly. You are better at problem solving. You have more ideas. Also, it affects the amygdala in the brain that regulates emotions, makes you calmer, makes you able to be more in control of how you react, so that you don't suddenly say everything that comes into mind and upset people. So you have a little space between the stimulus and your response to it.
Yes, yeah. Lucy was saying Reiki definitely affects the autonomic nervous system. And,
yes.
And,
yes.
Yes. And so one of the things I know that you do is you offer sessions to people. Do you do those over the phone and online also, for helping them to learn how to do the heart, as you call it, heart rhythm breathing?
Oh, yes, yes. I do the sessions live and also by Zoom. I do the heart focus breathing, and I also took William Rand's course, so I'm qualified to do distant Reiki initiations as well.
Okay, wonderful, wonderful. Well, a couple more questions, and then if we have any time, maybe you could give us an example of the breathing that you're
sure.
about. All right, so let's see. We talked about some of the major criticisms or misconceptions from science. I think you talked about not knowing the mechanism of Reiki, and also that some groups or studies do not have the 3 groups that they need: the control group, the Reiki group, and the sham group.
One thing, going back to the mechanism, so we don't know exactly what the Reiki energy is or how it interacts with the body from the outside, but what we do know from our measurements is, as Lucy said, it affects the autonomic nervous system, that part of the nervous system that controls all our organs, our heart rhythm, our breathing, etc. Anxiety, that's another one. So this is all in control of the autonomic nervous system. And we know for sure, no doubt about it, Reiki calms down the autonomic nervous system, shifts you to the rest and digest instead of the fight or flight. But also, as we know, Reiki gives you what you need. And if you're kind of tired and fatigued, then it will kind of arouse you a little bit too, also through the autonomic nervous system. So that's for sure. Also, it works through the hormonal system as well. So it will reduce cortisol hormone. It will to stop you being so stressed. It will maybe there are a couple of studies that show it would increase serotonin, which is a feel-good hormone. So that stabilizes the emotions. So yes, we know for sure physiologically how it works. It's just we don't know exactly what the Reiki is.
Well, if it produces good results, that seems pretty important. I think those doctors and scientists who are questioning the validity of Reiki should be happy with the results. Well, we'll keep trying. So future direction for Reiki research, well, the crowdfunding and the dental office and
yes, and all these other things, interesting things that haven't been done, like measuring effects of Reiki on brain waves and on EEG, electroencephalogram, AIDS patients, well, none of this has been done or published. So yeah, those are really good future avenues of research. And of course, making sure it's really important that when people go to all the trouble to do these experiments, that they do them properly. That is so important. They have the control groups, they have enough people in each group, and they are very careful about what's called confounding variables. So that's when you have things going on that might happen in some sessions and not in others. And then you don't know, well, I had music going in like half the sessions and not in the other half. So if you're just comparing how did Reiki affect your anxiety, and you had music in half of them and not in the others, then maybe it was the music that was having an effect and not the Reiki. So that's, you have to control for all of those things as well.
Wow, that's a lot of things to think about.
Yes. So
Well,
it's really important that the research is of high quality.
well, I really like the idea of the crowdfunding, maybe if there were something that could capture people's imagination. I would think that brainwave study would be super interesting, to a lot of people.
Yeah, and also MRI, because if we could do MRI scans of, and we have this dream of doing MRI scans of Reiki practitioners when they do self Reiki or when they send distant Reiki, and then having people who are not trained in Reiki perhaps having the MRI scans when they're sending themselves loving kindness or something, to see if Reiki is different from loving kindness. Wouldn't that be interesting? How is it affecting the brain and the brain structures? That would be really fascinating, but very, very expensive.
Yes, and MRIs are no fun. I definitely gave myself a lot of Reiki during my MRI. And
Well, actually, there are now MRIs that are open. There was the open MRI where you're not put in like a tube, which is less stressful.
Putting a tube with a vice around your head, and
Yes.
it's no fun. Okay, well, we have just I don't know, maybe another 5 or 6 minutes left. If you could give us an example of the kind of breath that you were talking about that could help what you now, is this a kind of Reiki breath, a Gassho breath?
Yeah, I think Gassho breath is just as good as the heart focused breathing that I do as well. So let's finish with a Gassho breathing. I think that would be really nice.
Okay. All right.
Okay. So let's have everyone sitting comfortably with both feet on the floor. And close your eyes. And connect to your Reiki. And then breathe the Reiki in through your crown on the in-breath, so it fills your whole body. And on the out-breath, feel the Reiki leaving every pore of your body, radiating out to infinity. And breathe nice and deeply and slowly. So I usually do like 5 seconds in. So it would be breathe in and 2 and 3 and 4 and 5, and out and 2 and 3 and 4 and 5. So just breathe the Reiki in, filling your whole body, and then let it out through every pore, radiating out into the universe. And take note of what sensations you feel in your body as you breathe the Reiki in and as you breathe it out. And remember, as you breathe it in, go in the whole body, right down to below your navel. And enjoy those sensations that you're feeling. And if any thoughts come into your mind, just ignore them and go back to what you're feeling. And we'll take one more deep breath in. Let it out. And I just like, out of curiosity, I'd just like to know what feelings people felt, what sensations people felt.
I definitely felt very calm. Anyone else want to contribute?
What part of the body did they particularly feel the sensation in?
This is Rose, and I felt very light, and I was about ready to go to sleep. It's very, very calming.
Mhm.
And yeah, I'm definitely going to incorporate that. I was wondering, Dr. Baldwin, what drew you to Reiki to begin with?
That's a long answer to that question. I'll try and give you the short version. So I'm a physiologist and I was working on rats. I was doing experiments on rats and I was actually testing blood substitutes that companies were trying to develop so that they could use them instead of donated blood on the battlefield. So I was injecting them into the rats. And then I moved my lab and my experiments didn't work anymore. So at first I found that the blood substitutes were causing inflammation in the rat's intestines. And as a control, I would inject saline and those rats were fine. And then when I moved, all of the rats were getting inflammation, whether or not they received the blood substitute or not. And the only thing that had changed was where the rats were kept. And I discovered that the rats in the new place were in a very noisy, stressful facility. And that's when I got interested in stress and how stress affects the body. And at that time, I needed someone to help me analyze data. So I hired somebody, a young woman, who actually turned out to be a Reiki master. And I had never heard of Reiki before. So that's how I got into Reiki, through her. Of course, Reiki has wonderful effects on reducing stress, which I learned.
Well, thank you for answering that. And I really think that I'm finding out that we're drawn to Reiki in many different ways and forms. And how I got started on my Reiki journey about 15 months ago was through a dentist, a holistic dentist. Um, so, and I'm amazed at how many Reiki people have horses. I had one horse who lived 31 years. And I'm amazed at why we're drawn as species together. So that's interesting. Thank you very much. I've loved your speaking tonight, and looking forward to getting your book. Thank you, Dr.
Great.
Baldwin.
Yeah, that reminds me, just in case you forgot the title,
Yeah.
here it is. And you probably have a back to front image there. So I'll read it. It's Reiki in Clinical Practice, a science-based guide. Reiki in Clinical Practice, a science-based guide. So I said you can get it on Amazon.
On Amazon. And then again, Dr. Baldwin's website is mind-body-science.com. And you can contact her for Reiki and heart math, breathing, and
I do equine facilitated learning as well. So helps. I have people do experiences with the horses. And I sometimes have Reiki practitioners who love to practice Reiki with my horses or my horse.
and that's in Tucson, Arizona. So yes, if anyone is close to there. And I am KarenHarrison.net is my website. And we look forward to connecting with you all on future podcasts. So thank you for joining us. And thank you, Dr. Baldwin, for a very fascinating discussion. We appreciate you very much.
Well, thank you. And thank you for the fabulous questions. All really good questions. Made it interesting.
Yes, thanks.